We're still talking about gram-positive, but now we're moving into gram-positive spore-forming rods. And there are two genera or genuses that are gram-positive form rods. So Bacillus is one genus and Clostridium is the other. The two diseases that we'll be speaking of that are in the genus Bacillus are going to be Bacillus anthracis and Bacillus cereus. These can grow aerobically. Clostridium, this genus, we've got four. So Clostridium botulinum, Clostridium perfringens, Clostridium tetani, and Clostridium difficile. So some of these we've talked about and we've mentioned before, but now we're going to hit it. And these are anaerobically grown. I made tables. You know, I like tables. I did not make another slide for Bacillus cereus, so we'll talk about this one. This is another one of the bacteria that produce an exotoxin, an enterotoxin, that we then ingest from contaminated food. So it causes food poisoning, and just like Staphylococcus aureus, if you've ever eaten something and within hours, maybe an hour and a half, 2, 3 hours later, no more than 6, you know you are not well. And you can kind of trace it back to what you ate. You feel it and you know it. So it has a quick onset. Bacillus, this genus, they are ubiquitous. They just live in soil. And so they form spores. They're very hardy. So they can contaminate a lot of food products, often seen in rice and grains. They can also be in vegetables and dairy products. A way to remember this one, they call it the reheated rice syndrome. We talked about it on Thursday that anytime you leave food above refrigeration, but you're not cooking it, you're basically incubating things to grow. So reheated rice, I think you went out for food and you went out for Chinese food and you got some rice, you got your leftovers, and you just sort of leave them on the counter and you go to bed in the morning, you're like, oh, I'm kind of hungry, and you eat that, right? So the spores, because they made it through the cooking of the rice, and they've been growing, they'll germinate, so they go from spore to a vegetative cell, and they have been, making their toxins. You're like, well, I heated it up, because, I didn't want it cold, that's gross. So the emetic toxin, so emetic is a type of enterotoxin that causes vomiting. That one's heat stable, so reheating it, you're still going to get it from that. And then another type of toxin that it makes would cause watery diarrhea. So this is one of those fun diseases, and I don't know if you've ever had this sort of food poisoning where you feel sick, whoop, and then you kind of think you're done. And you think, oh, I feel a little better. And then a few hours later, you're running to the bathroom, because now it's the other end. Be serious. Yeah, Bacillus cereus. Fun, fun, fun. So supportive therapy, usually it's self-limiting. The big thing is refrigerate your leftovers. Yeah, so you come home from that night, put them in the refrigerator, and then you're okay. Yes, you have both. So we've already talked about Staphylococcus aureus. We just mentioned Bacillus cereus, and we'll talk about Clostridium perfringens. So if it happens with ours, it's food intoxication. So the poison was in the food. Bacillus anthracis, this is an old-timey disease in the sense that it's written about in history. It is a zoonosis, so it plagues cattle, so sheep, goats, deer, those sort of animals have this. There are 4 ways to get anthrax. One is cutaneous anthrax, so it's telling you through a skin or through a wound puncture. Its other name, which helps you remember which one it is wool sorter's disease. So people that work with animals and with sheep. It enters through a wound, and it starts off just like a little itchy bump, and then it progresses to this black scar, black ulcer called an eschar. And that word anthrax means, anthracis means black, so you get this black sore, but then it goes systemic. And so it is fatal about 20% of the time. So you get bacteremia, septicemia, shock, and death. Things that Bacillus anthracis has, it has a capsule, it has a unique capsule. It's amino acid base and not polysaccharide base, so that helps it avoid immune system destruction. It has a toxin, it's an AB toxin, but it's so 1 binding and 2 potent toxins. One is called edema factor, and so that's telling you all the capillaries are going to get leaky. And then one is lethal factor, which causes tissue death, so necrosis. A version of this, in a sense, and what they're seeing more recently, because there's not a whole lot of, you don't see a whole lot of anthrax today. It does happen, like I said, if people work with animals, there is a vaccine, so if people are continually working with animals, they'll get the vaccine for it. Injection users, so heroin users, and there has been an outbreak, particularly in Europe, not really sure exactly why, but think of a heroin user and not using clean needles, and this is an environmental microorganism. So just through that injection, it is more serious than cutaneous, I guess because it's being injected, so slightly higher mortality. Another way you can get anthrax is through ingestion of raw or undercooked meat, and it flows the same way. However it enters, then you get the edema and necrosis, and it can lead to death about 40% of the time. And the last type is inhalation anthrax, so inhaling the spores. This is very uncommon. We're going to watch a video about bioterrorism and the history of that. As far as a case, as far as I know, unless there's a more recent one of an organically acquired inhalation anthrax, someone had purchased drums from Africa that were stretched with animal hide and played the drums, and the spores went in the air, and so they inhaled it and died of it. So like I said, there is a vaccine for people at risk, people that work with it. If they work with animals, if they're in the military, then there is a vaccine. This is one of those bioterrorist agents. And I think I just did the volume, so excuse me.
The possibility of a terrorist attack is a scary thought and a very real danger. Terrorists could attack the American public in many different ways, including a bomb or by releasing a chemical, radiologic, or biologic agent. A biologic attack, or bioterrorism, is the intentional release of viruses, bacteria, or other germs to cause illness or death in people, animals, or plants. Anthrax is the most likely agent to be used in a biologic attack. It only takes a small amount to infect a large number of people. It's inexpensively grown from just a few spores and can be easily engineered to be drug resistant, which means it's more difficult to treat with antibiotics. So what exactly is anthrax? It's a naturally occurring bacteria in soil that can be transferred from infected animals to humans, usually by handling animal products like hides or eating undercooked meat. Now, anthrax can also infect humans by breathing in spores that have been engineered as a weapon. In 2001, anthrax spores were mailed to news reporters and U.S. senators. These attacks involved letters which held only 1 gram of powdered spores, about the amount in a sugar packet, and still 22 people were infected and 5 people died. In comparison, an attack that used 2 kilograms of anthrax, about the size of a 5-pound bag of sugar, could infect 100,000 people or more. Scientists have developed models of what an anthrax attack might look like. Anthrax sprayed from a plane or truck onto a city is a likely scenario. People may not see, smell, or even hear the anthrax being released. This type of attack would lead to inhalation anthrax, the most severe form of the disease, which starts with fever and other flu-like symptoms. Symptoms usually appear about 1 to 42 days after inhaling these spores. Now, unfortunately, once there are symptoms, it may be too late to treat with antibiotics. All of this sounds frightening, and it is, but CDC and other federal agencies are working with your state and local health departments, and they're taking steps to prepare the nation for a potential attack. CDC helps manage a program called BioSense, and this program detects potential bioterrorism releases, including anthrax in communities. BioSense and other local systems help ensure that authorities are aware of an attack and can get medicines to those exposed as soon as the agent has been identified. Medicine for a bioterrorism response is stored in the Strategic National Stockpile, or the SNS. If a terrorist attack occurred, CDC would distribute antibiotics from the stockpile to your state and local health departments, who would dispense it to affected communities. Now, here at CDC, we conduct emergency preparedness exercises to help us plan, prepare, and practice what to do in the event of an attack. Exercises may include distributing medical supplies or evaluating a laboratory's ability to collect and test samples. Other exercises involve subject matter experts who work through an emergency scenario from start to finish, determining all the steps various agencies need to take. We also learn from real events in our communities, such as the 2009 H1N1 pandemic. While the threat of a terrorist attack is frightening, it's important to remember that CDC and other agencies are taking steps to protect our communities. We have medicine and trained staff ready to act. You can learn more about anthrax at www.emergency.cdc.gov.
So any questions on bacillus? So Bacillus cereus or Bacillus anthracis? Yeah.
So has that ever happened before?
Other than it
US
being
soil?
mailed, the spores
Yeah.
being mailed. So throughout history, though, sorry, I didn't brush up on which civilizations would fling anthrax-ridden cattle over fences to infect a town? So old-timey bioterrorism.
Has it ever happened here in the
Recently,
States?
no,
Other than
other than
the mail?
the mailing. And of course, all countries keep a stockpile of it just in case we want to do that, which I know just makes you feel warm and secure inside. This was made, I believe this video was made in 2011, and I think they probably learned a little bit more about their distribution and things during the pandemic. So assuming that they are still working on bioterrorism, because that changes with administrations, all that stuff. Don't kill the messenger. Sorry. All right, so spore-forming rods. So genus Clostridium, and we have 4 to look at, and I placed the chapters there for you. So the genus Clostridium, some characteristics, they're all gram-positive rods. They have needle-shaped endospores, usually, so the spore is on one end of it. They are obligate anaerobes. We talked about those. So obligate means they must. So they need a low oxygen, no oxygen environment to grow. Just kind of reminding you, if they're in if it's oxygen, then they can go through sporulation, and they are a dormant, very hardy spore. And when things are ideal for them, then they can germinate, and then they become a vegetated cell, can divide, grow, and then make their toxins. So Clostridium difficile, Clostridium botulinum, we're going to go through these 2 first. We mentioned Clostridium difficile before. This is the #1 cause of hospital-associated diarrhea. And so I kind of gave you the #1 there, and the other little icon is that it's becoming antibiotic resistant. Anytime you have a opportunistic pathogen, it is in hospitalized people. Normally there is wide antibiotic use, so it becomes antibiotic resistant. It makes an enterotoxin, which is where you get the watery diarrhea, and strains that make the cytotoxin, so death to the lining of the intestine, so to the colon, then you get bloody diarrhea, so dysentery, and what they call pseudomembranous colitis. Basically the mucosa just kind of come off in sheets, and they thought it looked like a membrane. It is on the rise in frequency, virulence, and antibiotic resistance. So Clostridium difficile is an example of a super infection. Clostridium is part of the normal microbiota, but normally they're kept in check by the good guys that live in the gut. And so when a patient is on broad spectrum antibiotics, it wipes out a lot of the beneficial bacteria, reducing competition, and then the Clostridium can overgrow in this case, and so then you get an infection. So usually these are sick patients treated with antibiotics, and then they get C. diff, and it is profuse, it's very smelly, and it's very difficult to get rid of and clean up after, because they can just form spores, so they're very resistant to disinfectants. So prevention is good hygiene, hand washing, disinfection of surfaces, that's great. And like I said, you can see that they are part of the normal microbiota. So changing antibiotics, switching, taking them off of antibiotics, and if that doesn't work, a lot of times it will recur afterwards, and sometimes just total replacement of their microbiota through a fecal transplant, so fecal transplant therapy. So the next two, Clostridium botulinum and Clostridium tetani, they both make neurotoxins. Toxins function differently. So in Clostridium botulinum, that neurotoxin is going to stop the release of acetylcholine from motor neurons, so going to skeletal muscles. And you end up with flaccid paralysis. And I'm not being mean to the babies, but we'll talk about floppy babies in a minute, but just the picture, so flaccid paralysis, can't move, very soft, like muscles aren't hard if you were to feel that. Clostridium tetani, what it's going to do is it is going to inhibit the release of a inhibition neurotransmitter that causes muscles to relax. Remember, you've got your flexors on the front, and then so if you're going to flex, then you need the extensors to relax. It stops that. So what you end up with, because it plagues a lot of infants worldwide, we immunize against it, but then you get rigid paralysis or spastic paralysis. So you're going to get tetany, that sustained maximum muscle contraction, which is how it got its name. So Clostridium botulinum outbreaks are very rare. Every now and then, if there's a home canning incident, and usually of low acid foods, I think the last outbreak in 2014 or 15, can't recall, at a church picnic, potato salad. Always potato salad. I don't eat potato salad wherever I go. Just nope. Anyway, so outbreaks through home canning. It is one of the most powerful toxins that exists. So very powerful neurotoxin. Like I said, we get that flaccid paralysis. We'll talk about babies and honey in a second. But if somebody's getting Botox treatment, they take that toxin and they dilute it, they inject it into the face, and it stops the movement of those skeletal muscles, or the muscles of the forehead usually, or it can be wherever. And so relaxation of the face reduces the appearance of wrinkles. If somebody gets botulism, then we would treat with antitoxin, and the danger, of course, is if it goes to the diaphragm, because then we have cessation of respiration. And like I said, so we've got infant botulism, which we'll talk about in a second. Foodborne is pretty low. It can also enter, because these are environmental, they're spore formers, they can also enter through a wound. So you can also get wound-incurred botulism. So back to the babies. I don't know if you've ever noticed the raw unfiltered honey. There's a movement, of course, and it's sad because mothers, they're trying to do the right thing. There's high fructose corn syrup in a lot of foods, so if they're going to add a sweetener to something, we'll use honey. It's natural, and organic is always better, right? So they buy raw unfiltered honey, but on the back it says, warning, do not feed honey to infants under a year, because what happens, if you and I eat it, our immune system is going to take care of it. It doesn't, ever lead to botulism, but in an infant, those spores are allowed to germinate, then you've got bacteria multiply, then they make the neurotoxin. If it's under the, a baby will just start to move less, and then you realize, oh, floppy baby. So pick up the baby, and it's just limp. And like I said, the danger is always that it's going to go to the diaphragm, and so you need to do respiratory support. And it's just, oh, that was your book, yeah. So talking about home canning is when not that many people home can anymore, but particularly if it's a low acid food, so they can survive temperatures above the boiling point of water. So we get flaccid paralysis with the neurotoxin from Clostridium botulinum, and we get spastic paralysis from the neurotoxin from Clostridium tetani. The neurotoxin is called tetanospasm, and just kind of what I said, it stops the inhibition of the muscles. It used to be called lockjaw because when people, before immunization, if somebody were to get tetanus through a wound, this is the whole thing about a puncture wound and the nails. You know, if you step on a rusty nail, you gotta, are you up to date on your tetanus shot? Because it needs an anaerobic environment. So the deep puncture has less oxygen than a superficial wound, and that's just the whole connection between the whole stepping on a nail and needing to go get your tetanus shot. And the rusty thing is just because it's been out there a while, so it may have some spores on it. But the locked jaw, so it typically will start with the jaw starts to freeze up, so someone can't open their jaw. But it'll progress to all of the muscles, even, you can Google it, there's some horrible pictures in history, because they didn't have any treatment for it or immunization. But it's pretty rare at this point, except globally it causes a lot of infant deaths. So 60,000 newborn deaths annually in developing countries. Like I said, we immunize against that. So that's some information, Clostridium tetani. And so we'll talk about the DTaP vaccine in just a minute. So Clostridium perfringens is our last Clostridium. It causes gas gangrene, or its other name is Clostridial myonecrosis. So myo means muscle, necrosis means death. In order for this to occur, you need two things. You need dead tissue and anaerobic conditions, so poor moving blood or a deep wound. It makes a cytotoxin, which is an alpha toxin, very powerful, and this toxin basically just cuts the heads off of the phospholipids in the membranes. So it enters through a wound. Where it gets the gas gangrene part is it has other enzymes that degrade our tissues, and then they ferment and they make acids and gas, and you can see the gas bubbles, so that's why it's called gas gangrene. Anytime somebody has poor circulation, so diabetic patients, atherosclerosis, elderly, particularly with your diabetic patients, they don't have great sensation in their feet nor circulation, so they may not really even notice. And so this is a ulcer from a foot from a diabetic patient, so they would have to debride the wound, antibiotics, and then hyperbaric oxygen therapy, which we mentioned because they are anaerobes, and that stops the pressure, and the oxygen stops them from making that alpha toxin. Anyone like history? We're into history. Okay, so if you've ever watched war, and prior to antibiotics, there was a lot of amputation involved with soldiers, and so they would get a wound in the battlefield, didn't have antibiotics, they're out there in the dirt, and so often they would get gas gangrene, and they know if they didn't amputate, then that was going to go to septicemia and shock, and so they would just amputate because that's all they could do. In history, though, they knew there's something called angel's glow, particularly in Civil War, there's writings of it, that if a soldier's wound glowed at night, they had a better chance of living. And so they're like, oh, the angels. What it turns out, there were nematodes in the soil, so roundworms, because they're in the dirt, not in clean environment, and now they have this open wound, which is just food for the worms. But the worms have a bacterium in them called Photorhabdus luminensis, and so it was a fluorescent bacteria that would glow at night. And so that's what was glowing, and this organism that was making antibiotics, because we had a lot of antibiotics either from bacteria or fungi that grow in the soil. So the worms were debriding the wound, and then the bacteria were releasing antibiotics. Fun fact, there you go. You can read about it. All right, so that's there for you. Just kind of walks you through the whole progression of it. But the big thing is good wound care and avoidance of that. Clostridium perfringens can also cause food poisoning. So it's very similar to Bacillus cereus. Spores germinate, make the toxin, acute abdominal pain, diarrhea. This one, though, it is inactivated by heat, so it's not a heat-stable toxin. So this would only be through uncooked food, so cold deli meats or salads or things like that. They do estimate, though, that it's 966,000 cases per year, but those are our three for food intoxication. So Clostridium perfringens, Staphylococcus aureus, and Bacillus cereus. I'm going to stop this video. And yes, I know I need to post them. I'm a little behind.